we're on a short time frame here. Very quickly, I'm going to introduce you to Dr. Jackson. He's got a few words for you about this legislative reception.
Hello, everyone. I would first like to thank all of you for coming out to the Texas Medical Center Innovation Institute. And I would like you to give TMC Innovation, the board members, the team here, a round of applause for hosting us here today. All right, there we go. Also, I would like to take a moment to thank those members of the Texas legislature who have shown so much courage as this new emerging industry is at our doorsteps. I think the genie is out of the bottle, and pretty soon, whether it's this year or in a couple of years, we will be having to answer the question of regulatory oversight for some of these novel psychoactives. So please give the members of the legislature a round of applause as well. And I know we're short for time. Definitely want to acknowledge Congressman Dan Crenshaw. He has shown so much courage with what he's dealing with, but you know, he comes from good applause, and thanking him for coming out. So I won't take up much of the time, but I do want to talk on how important it is to evaluate, certify, and verify these novel products. Vyripharm has 3 patents that formulate a basic foundation for this industry. Now, currently states have cannabis programs, and I commend Texas for the Texas Compassionate Use Program. Definitely from what you heard from Laura, it is working. But now we must step in and bring this industry into the ecosystem of traditional pharmaceuticals. The Texas Medical Center, which is the largest medical center in the world, has the access, the researchers, the know-how to make sure that these products are not only safe for our veterans, but also for the public in general. But more importantly, when you look at this industry, it actually touches every asset or every facet of the Texas legislature: business and commerce, agriculture, agriculture and livestock, public health and public safety, water, appropriations. How do we galvanize and garnish those revenues from this industry? We can't do it if we follow the model that's out there now. Finding what is in it as far as the level of THC, CBD, is not good enough from a pharmacological or medical standpoint. You can't have a medical program without accessing and capturing true medical data. The Texas Medical Center stands ready, Vyripharm stands ready to support the Texas legislature, to support our great Congressman, Dan Crenshaw, and also to support the public health and public safety of Texans. Again, Vyripharm has over 60 patents, 3 of which are in this particular area. We have developed diagnostic tools to be able to evaluate how well these products actually work in our veterans and in our citizens of Texas, as well as the United States. Currently, Vyripharm is establishing our beta site laboratories, 2 of which is right here in the state of Texas, 1 of which is in Colorado. The other will be in California at a high-level institute. The next will be in New York, and the final 2 will be in Mississippi and Alabama. We've been working with the FDA to establish a footprint, a network of laboratories to capture that data, to find out what strain of marijuana, what strain of cannabinoids, what synthetic cannabinoids even works for a particular disease state. This is critical data that is not being accessed now. Currently, what we have is track and trace and RFID tags, which is fine, but no one can truly state claims on that. If we're going to give it to our veterans, if we're going to give it to our family members to battle cancer, PTSD, epilepsy, we're going to have to move to the next level. The legislature here in Texas has done a great job, and we support them 100%. But now it's time for the next generation, and Vyripharm stands ready to do that. And finally, this is just an image of how that process will work. Every asset or every facet of the supply chain, the data will be captured. So now the legislature, Texas, the Department of Public Safety, law enforcement will have a true data network in understanding where, how, when, how well these drugs are working in our citizens. Number two, when we talk about Homeland Security, once this bill passed, or whenever it passes, either this year or in a couple of years, that's going to open the door for interstate trafficking. We have to be able to control our borders with the access of these drugs coming across, and the only way to do that is have a true regulatory oversight, a comprehensive regulatory oversight, and Vyripharm already has those patents. It's already federal, so the Texas legislature does not have to worry about creating a new wheel. It's already there protecting them for risk mitigation. So I'm going to stop now and open the podium to our keynote speaker, who is far more important than I am. And I am so excited to have him here. He has shown the ability to show strength as we move forward in evaluating these novel drugs for our veterans. And I want to thank him for coming. And again, I want to thank you all for coming out. And if you have any questions, please take time to meet some of our members of the Vyripharm team who was here. And finally, I also want to give thanks to our CEO, Jerry Bryant, who is, I would say, a genius, but quietly kept. So if you have a chance to run into him, please pull his coattails and take about 5 minutes to hear some words from him. So I want to thank you guys, and look forward to speaking with you and seeing you soon.
How are y'all doing? I'm supposed to give the keynote. I don't know how much of a keynote this will be, but I will share with you a few things that we've been working on and how we think legislatively and from a policy perspective about healthcare and especially healthcare innovation. Joe, thanks for inviting me and putting this on. Thank you all for your interest in this important subject. Thank you all for your incredible work towards this, what truly helps people in a very profound way. Nobody likes our healthcare system, it seems, in America, and one of the primarily because it's too damn expensive. And one of the ways out of that problem is fundamentally innovation. That's how you get out of most problems whatever the issue may be. And in that spirit, every year we do a Healthcare Innovation Summit, and I give an award named after my mom, Susan Carol Crenshaw, who died of cancer when I was 10. And the reason I name it after her is because she was patient number one for Taxol, this experimental treatment in the early 90s, and which eventually became Taxotere, a very important drug for anyone who's ever had breast cancer. And last year we actually gave it to Billy Cohn, or this year we gave it to Billy Cohn, who is of course at J&J Labs here, J Labs and part of this innovation center. And for his work that has helped so many people. So we're really proud to be part of that space. And you find some really interesting things when we do these presentations. We have these innovators come up and present. I mean, you hear from, for instance, Hope Bioscience, where they're doing stem cell therapies that have actually helped people with Parkinson's who were completely immobile get up and walk on stage for our presentation. Really fascinating things that can happen with stem cells, just not researched enough, and the FDA just won't approve some of these treatments. We'll get to the FDA problems, which is fundamental to our problem here in a second. We've heard from Spark Biomedical. They have a non-intrusive, it's just a completely exterior electromagnetic stimulator that stimulates the right part of your brain that almost completely stops the symptoms of opioid addiction. And so they've got these testimonies from people who are completely addicted to opioids, just need it every single day, and then within 2 days they're like, I just feel fine, just from an electromagnetic stimulation. It's absolutely fascinating. They have trouble getting funding because CMS doesn't usually have funding categories for devices. So we'll get to how we're going to try and solve that problem here in a minute too. There's another FDA problem. Another person we've had, actually a good friend of mine, and she runs this company. She's like in her she's 30, 31, but runs this company. It has this invention called IntuiTap, which basically is a sensor. It's a very simple device. It's a sensor that allows doctors to give an epidural injection and not miss. So imagine not getting stabbed in the spine 4 times. That would be really cool, I bet, especially when you're about to go into labor, let's say. So these amazing innovations that, frankly, are still kind of stuck in the process, mostly because of an FDA that has become so bureaucratic and so risk-averse, and also such a black hole of information that you can't even figure out where to go. Our innovators have to do yet another round of fundraising and get their investors on board to do another clinical trial because the FDA is like, I didn't like that one. Well, what don't you like about it? I don't know. That's the kind of answers they get. So FDA reform has to be a major priority legislatively. And there is some bipartisan agreement to that. Now look, when you look at the left and the right spectrum, obviously you probably know that I'm on the right. And so what does that generally mean? Besides the normal annoying political back and forth that you see every day about who's a worse person, okay, forget all that for a second. What's the real difference between the left and the right? And the real balance between the left and the right? Well, one of them is the right is generally more comfortable with risk. Okay, a little bit more freedom, which entails a little bit more risk. We want a little bit less regulation. We want more freedoms, and we'll just let the market society kind of figure that out. We entrust people to do that. The left is the opposite. They want a little less freedom because they want less risk. Okay, and that's a healthy balance, to be honest. But I think we're out of balance right now. I think the FDA is so risk averse that we're not innovating the way we need to innovate, and the bureaucracy is designed that way. As innovators, you want to get going. You want to get to that next step. A bureaucrat is much better off just saying, no, because if there's any risk, then I'm going to take the fall for it. I don't want to deal with that. And so there's a problem with the incentive structures there, and it absolutely needs reform. We can take small bites at the apple with the FDA. We do that through when we reauthorize user fee agreements, and a negotiation sort of happens between the industry and the FDA itself. Because the FDA takes user fees from pharmaceutical companies, from drug companies, from biomedical companies, where you basically pay to get your process done faster. Okay, that's fine. It's a decent thing, and then they renegotiate that every year and say, look, you need to make these changes. We were successful in getting some changes made in this recent user fee agreement negotiation, specifically around regenerative medicine. It's on the FDA. You've got to take some more steps here to actually reclassify, say, stem cell therapy. Because right now they're classifying stem cell therapy as if it's a drug, when in reality it's just your own cells that are recultured, reproduced, and then injected back into you. It's more like a bone marrow transplant than it is a new drug, but the FDA wants to treat it like a new drug. Again, almost just because they like being difficult, I swear, at this point. It's very frustrating. So we're taking small bites of the apple, but a lot more needs to be done. The balance is out of whack. You've got to move the balance towards a little bit more freedom, because you can have plenty of freedom and still have some safety. There's just unfortunately some people who believe that if one regulation is good, then 10 more must be better. That's obviously a bad philosophy, right? There's got to be a balance there. The other thing I mentioned too is what CMS does. So even if something gets through the FDA, you've got CMS that won't even categorize certain things and to allow payment for them, and therefore it can't get private funding because there's no profits incentive to do so. That's a problem too, something that needs to be addressed. One of the reasons I'm going to run out of here real quick after talk to y'all is because I'm about to go to a meeting about ARPA-H. So ARPA-H is a recently authorized piece of legislation, very bipartisan, I think a really cool idea that is modeled after DARPA. People understand what DARPA is, the Defense Advanced Research and Production Agency. I'm not really, whatever, you know what DARPA is. It makes really cool stuff, and but for defense. And so the idea was that you should do something similar for healthcare innovations, something similar to what you're seeing here in this kind of space, because you can get NIH funding. There's plenty of money out there for your basic sciences, right? They go to fund universities for basic science. So what common refrain you hear sometimes is like, the government makes all these drugs, and we fund the making of all these drugs, and so like, why are people paying $1,000 a pill for it? And on the surface, that seems like a good argument, but what people don't realize is that it actually takes billions of dollars to take it from basic science at a university to a commercialized product. So ARPA-H is now seeking to fill that void, right? Let's invest in these high risk but high reward, whether it's devices or drugs, whatever it might be, and help them get to commercialization, so help them get to that next step. And we're really trying to make sure that that agency is then headquartered in Houston, right? And been part of this wonderful, innovative ecosystem that we have here. I think with that, we could really see some really interesting breakthroughs in the future, especially since we just passed some legislation that will probably inhibit some pharmaceutical breakthroughs in the future, unfortunately, by doing price controls on drugs. That was unfortunately just passed in legislation very recently. And that will result in less new innovative cures, because if there's a price control on a drug and you have to take the price the government says you have to take, or face a 95% tax on your revenue, and yes, that's actually in the bill, then you're not going to invest that money. You're going to invest in much safer investments. And that's a problem when we're talking about innovation. Hopefully that's countered to an extent by ARPA-H, which is about $40 billion in funding. And I think there's while our healthcare system is too expensive right now, it is also true that we have the best healthcare system. This is the place where you can get the best healthcare. America is the place where you get the best healthcare. You travel to Mexico to get healthcare if you need something that is a well-known drug or device or treatment, well-known, very well established, and it's just cheaper. But if you've got a rare form of cancer, you're coming to Houston. So you don't want to lose that competitive edge. America is the only one with that competitive edge, actually. We're the only ones truly innovating on a constant basis. And we need to get out of our own way so that we do it better, and we also can't lose it. And so there's got to be this balance, legislatively speaking, from a policy perspective on how we do this. Because look, some want to call healthcare a right. And it might seem like splitting hairs, but it's not quite a right, but it is a need. It is a need, and we do have an interest in everyone having access to good quality healthcare. I can agree with my Democrat friends on that. Is it a right? No, because if you make something a right, then you also have to force someone else to give you that thing. Right? So now you've got a problem with infringement on basic freedoms, but it's a need. And so how do we create that safety net? How do we create that need? And you do it in ways like with Hamilton Healthcare. That was also one of our presenters at a recent summit that we did for healthcare innovation. And you get access to healthcare out there much cheaper. And then you've got to innovate how you actually pay for that. So we've also had presentations on companies that have created basically a debit card that is associated with your insurance that you then pay for healthcare with. We need to simplify the financial part of healthcare to a massive extent if we're going to be truly innovative. And we have to do things like give everyone a health savings account. Put the money in that, attach it to a debit card, make this your payment system from now on. Don't treat, and I tell people, imagine if we treated the way we deliver food to the poor. Imagine if we did it the same way we deliver healthcare. So basically, you would go into the grocery store. There would be no prices on anything. You would take whatever you want. You would go to the cashier, and they would say, "Well, actually, you can't even buy the tomato until you buy the cucumber. Why? Because I don't know. That's just what the coding is." And then you get out, and maybe they'll charge you a little bit later, but for the moment, they'll charge a third party, and then maybe bill you later. You really have no idea how much you're going to end up paying for your groceries. That'd be a really strange way to deliver food to people, but it's not what we do. Instead, we deliver them a voucher in the form of food stamps, and they go and pick out what they want, and they can use their own consumer instincts to determine what has more value and what doesn't, and then they leave. You need to think about healthcare the same way in principle. It's obviously far more complicated than just getting food, but you need to think about it in principle the same way from a legislative standpoint if we're ever going to innovate our way out of the financial mess that our healthcare system is. And so with those thoughts, I'll leave you and wish me luck as we try to strategize with other good Houstonians on how to get ARPA-H here. And I think really, I think that would be fantastic for this place and for Houston in general and for America. So thank you all for doing this, and it's great to see you all.
And Congressman Crenshaw, thank you again so much for being here. We ran him over, he ran out of time. Please, let's just thank him again as he's heading out the door.